several different categories of dementia, and I think this is important to bring out. 60% of all dementia is related to Alzheimer's disease, which we know is a disease process in the brain that attacks the brain cells and many of the electrical connections between the brain cells. And we can actually see that at autopsy when an individual's brain is looked at by a pathologist. There's other dementia, though. There's vascular dementia, where there's an insufficiency of blood flow to the brain that potentially causes a stroke. And that area of the brain then may be affected long-term to create symptoms of dementia. And then there are other disorders that can create dementia as well. Alcoholism is one. Parkinson's disease is another. Other kinds of neuromuscular disorders. So everybody now is using the term Alzheimer's for dementia, but really dementia has Alzheimer's as the major component of the other disorders.
By far the most common cause is Alzheimer's disease. So Alzheimer's disease is one specific form of dementia. And it tends to be a problem that starts with memory. And over time, one tends to get other things involved, so not just memory, but other bits of thinking. And over time, it becomes more the whole brain, a sort of global cognitive impairment. Probably about 50 or 60% of people have Alzheimer's disease in terms of the whole group of people with dementia. And if you think about the sort of other causes, the next in line, probably people who develop problems thinning of their blood vessels, what's called vascular dementia or vascular cognitive impairment. After that is a condition called Lewy body dementia. So that's a condition that looks a bit like Parkinson's disease, but tends to start with dementia rather than starting with changes in movement, slowing of movement that you see in Parkinson's disease. And then fourth in line is frontotemporal dementia, so a condition that is less common as you get older, but is a condition that affects your behaviour and your language, and in a younger age group, so under 65, tends to be almost as common as Alzheimer's disease, so one of the more common types. Those four things together probably account for somewhere around 95% of all causes of dementia, and then that 5% is lots of other things, so probably hundreds of other things which are all relatively rare, but can cause this acquired progressive problem in your thinking and behaviour.
A disorder we refer to as multi-infarct dementia, so you've had a lot of small strokes. There's Lewy body dementia, where neurons die, but they die in a different manner than they die in Alzheimer's disease. There's frontotemporal dementia, where the frontal lobe and the temporal lobe have enormous neuron death and can no longer communicate with each other. So they all cause dementia, but the major cause of dementia is Alzheimer's disease.
Dementia is a progressive disorder, and Alzheimer's disease, which is the commonest cause of dementia, progresses in a very kind of characteristic way over between 5 and 8 years, and ultimately leads to dependence and death. So it would be fantastic if we had treatments that somehow interfere with that process and slow it down, but we don't. What we do have is drugs that improve the symptoms of dementia. And they improve the symptoms to a modest amount, but to an amount that's noticed by the families of people with dementia and their doctors. And if I can give an example, in many of the studies that have been carried out, the amount of improvement that patients and their families will see when they start treatment is roughly equivalent to between 3 and 6 months of the deterioration of the condition. So we're not talking about stopping the disease or turning the clock back, but we're talking about improving the symptoms so the patient looks like they would have done a few months earlier.
Can you do to reduce your odds of becoming demented? That's a heck of a question, isn't it? Recognize that if you live to be age 85 years, your risk of developing dementia is the flip of a coin, 50-50. Step number 1, you've got to exercise, and you've got to do aerobic exercise. Why? That turns on the genes that code for a brain growth hormone, if you will, that allow you to grow new brain cells in your brain's memory center. Step number 2, you've got to sleep well. Lack of sleep, lack of good sleep, having poor sleep hygiene is directly associated with increased risk for becoming demented. You might even need to have a sleep study because you might have sleep apnea and not even know it. Sleep apnea is related to increased risk of becoming demented. And number 3, you've got to control your blood sugar. A recent study appearing in the New England Journal of Medicine, September of 2013, looked at a group of adults who did not have diabetes, measured their blood sugar, and then followed these individuals for approximately 3.7 years. What did they find? They found that there was a direct correlation between even subtle elevations of their blood sugar and significant increased risk of developing dementia during that period of time. And keep in mind that the elevation of blood sugars in these individuals who were not diabetic were very mild elevations, like to 105 and 110. It becomes very relevant then as it relates to the food choices that we make. Eating higher levels of carbs and sugar is a surefire way to elevate your blood sugar. That's why a diet that favors higher levels of good and healthful fat while cutting the carbs goes a long way towards a dementia prevention program.
One more time each way. So your hand comes across, and then your head tips to the side. That's it. And relax.
5 foods that helps to prevent dementia are: 1. Broccoli. Consumption of broccoli enhances the function of the brain. Broccoli contains choline, which boosts the memory and better cognitive abilities. To prevent dementia, enhance the consumption of broccoli. 2. Berries. Berries are the rich source of anthocyanin, which prevents dementia and Alzheimer's. Apart from this, berries also contain vitamins like C, E, antioxidants, which are important for better mental health. For better results, enhance the consumption of blueberries, cherries, and strawberries. 3. Fish. Fish contains omega-3 fatty acids, which keeps your mind sharp. For better results, add fish to your diet. If you don't like the fish, then you can also consume flax seeds. 4. Beans. Beans and legumes are the rich sources of iron, potassium, magnesium, and folate content, which are important for neurons and other bodily functions. Add more beans and legumes in your diet to increase brain function and prevent dementia. 5. Nuts. Unsalted nuts are high in antioxidants and healthy fats. Walnuts are particularly high in omega-3 fatty acid, a brain protective nutrient. Aim for 1/4 cup of nuts, or 2 tablespoons of nut butter daily. So these are the 5 foods that helps to prevent dementia.